So, Angela, I want to talk about the caregiver themselves because a lot of time they develop health issues because they don't take care of themselves because they're so busy taking care of everyone else. So, what advice do you have for the caregiver in how they can practice self-care?
African American caregivers are some of the most stressed out caregivers, meaning that they care for people who are much sicker than majority population. So we have in our culture a lot of amputation, a lot of heart disease, a lot of cancer. Now, some of this is lifestyle, but some of this is environmental. And so the kind of care that African American caregivers provide, generally speaking, can be very much like bringing a hospital into your living room. However, we are the ones, when the researcher calls, who will say, I am not stressed. So when we talk about caregivers taking care of themselves, it's really a hard nut to crack. I mean, you wouldn't think if I'm taking care of somebody 24/7 and I'm exhausted and I can't get to church, I don't go out with friends, you would think it would be very easy for me to accept help, right? But it's not. Because now you're talking about someone taking my place as the primary care provider for someone that I love. And they may not do it the same way. It doesn't mean that it's not acceptable and it's not good, but it's not me. So in talking to caregivers, if you've got family members who are caregivers and you're trying to get them to take care of themselves, if you just say, Auntie, are you stressed out? That may not be something that resonates with her. But if you begin to ask them questions like, when is the last time you took a week's vacation away from this? When is the last time you got together and socialized with some of your friends? Have you had your own checkup in the last year? And if they're answering no, I haven't done those things, then you know that they're dealing with some form of stress. So sometimes we have to approach it like, caregiver, take care of yourself because you're important and you deserve it. You didn't even realize that you're not socializing, you're not getting a break, you're not having fun, you're not laughing. You didn't even realize that. But sometimes they still can't receive it. So sometimes we have to tell them, take care of yourself so you can better take care of the older person who needs help. It's just like when you're on a plane. If the oxygen mask comes down, what do? You put it on yourself. I would pass out too. Somebody said, pass out. I'm with you, girlfriend. But you put it on yourself first so that you can take better care of anybody else who's traveling with you. So caregivers, if you're in the audience, we want to really encourage you to take that time away. It may not be the same exact care that you might provide, but in most instances, it'll be okay. I mean, you're not going to leave your older relative with, boo-boo the fool, but in most instances, it'll be okay. We encourage you to take care of yourself.
So for up until 2 years ago, for 5 years, I was a long-distance caregiver for my mom. And fortunately, I had a very good support staff in place, but that is not always the case. So, Angela, what advice do you have for long-distance caregivers?
How many of you guys are long-distance caregivers, meaning your relative lives in a distant, just a few? That's kind of interesting. Usually in the D.C. area, when I ask that question, everybody raises their hands because there's so few people actually from D.C. who live in D.C. But at any rate, if you have an older relative who lives somewhere else, you want to plan your care commutes in advance. And a care commute is just you going to see them and to make sure everything is okay. So my dad is in Ohio, and when I do my care commute, I'm ready. I got all my ammunition. I've scheduled my meetings. I know who I'm going to talk to. I know exactly what I want to get done while I'm there. I just recently did a care commute back in March, and my two objectives were to repurpose some things in the kitchen and to redo the bathroom so that he can remain as independent as possible for as long as possible. So by email, I had already interviewed people, talked to them over the phone, decided, had them send me pictures of various options, made my decisions, who I'm gonna hire, meet me there on this day. So that's the way you have to do that. You have to really kind of plan it out, because I cannot fly there every other week. You also have to think about, while you're there, let me see what's really going on. Because sometimes your relative will tell you everything's okay, and they're in a mess. And sometimes, you know, some of your relatives, they complain about everything, and you get there and they're doing okay. So you want to be observant. And again, you're going to look at those ADLs and ADLs that I talked about earlier. So there is so much technology out there that you guys can use, and you don't have to be at a distance. If you don't live with your older relative, there's lots of technology out there that can help you. You know, you can do Skype calls. You can sometimes just seeing that person will give you a sense of how well they're actually doing. But there are things like all kinds of medical kinds of supports that'll tell you whether they took their medicine. There's, you know, pill boxes that are connected with electronics. If they didn't open their pill box, they didn't take their medicine. There are sensors that you can put around the house, not cameras, but sensors. Like there's sensors that go in the bed, there's sensors that go in the bathroom, there's sensors that can go in the refrigerator. If the refrigerator door does not open, they're not eating. If the sensor in the bed doesn't say that they got up, they're probably not doing well, because everybody should get up every day, right? So there's a lot of technology that you can use. You can even use technology through the medical community, where they can link in and get blood pressures. They can actually download their blood sugar levels. They can do all of this stuff via computers and technology brought into the home. So when you're caregiving, whether your care commute is 15, 20 minutes, like from DC to Virginia, or if it's across country, just make sure when you go in that you've got your list and you've decided what you want to accomplish during that time. Do everything you can before you get there, so when you get there, you're locked and loaded and you can make it happen. So respite care is actually just taking a break. It can be, you know, someone coming into your home to relieve you. It can be your older relative going out to an adult daycare facility so you can have a break during the day. A lot of working caregivers use adult daycare for that. Or it can be taking your loved one to an institution for like a week or two if you need to take a break. But respite is really, really important for caregivers, because, believe it or not, the people who commit elder abuse most often, family members who are stressed out. So respite care is important in order for you to be able to stay the course as a caregiver. Respite care is beneficial because it's going to give you a break, you get a chance to breathe, go out and have some fun. But what a lot of caregivers do when the care provider comes in to give them a break, they use that time to catch up on work, right? But that's not the purpose of respite. Let me share a story about a woman in DC who finally got what respite was all about. We tried to encourage her for months to take a break. I used to run the DC Caregivers Institute. She's like, no, I can't leave my mom, but my blood pressure is high, I'm gaining all of this weight, my blood sugar is like having so many problems. So finally, we convinced her, walk around the block one time. Nothing's gonna happen if you walk around the block one time. She finally started walking around the block one time. Then next thing you know, she's walking around the block 2 times. Then next thing you know, she hooks up with another caregiver and they're power walking through the community. And the next thing you know, she's lost 30 pounds, and the next thing you know, her blood pressure medication had to be decreased. Respite is really, really important. There are a lot of instances where caregivers will pass away before the older person because of stress. So if you're a caregiver or you know a caregiver, you provide the respite if you're not a caregiver, because when your turn comes, you're going to want somebody to give you a break.